So thank you all for being here. We at the National Safety Council are really happy and proud to be co-hosting this year's event with CRE-MSD, and I'm really excited for all the great presentations that we have lined up for later this morning and this afternoon as well. Like has been mentioned, I'm Dr. Paige DeBaylo, Director of the MSD Solutions Lab at the National Safety Council, and I'll get a little bit more into what we do at the Council in the coming slides. But first, just a quick agenda for today. So I also taught undergrads. I taught 400 intro to psychology freshman students. So they love an agenda slide, so I'll start with that first. So I'm just going to give a very brief introduction about what we do at the lab. It aligns a lot with the mission of CRE-MSD as well, so you'll see a lot of through lines there. And then I'll move into talking about some surveys that we've run in the lab. So I am going to be taking more of kind of a data approach to maybe set the tone for the day, and then we can layer on some of that practical applications on top of what I talk about this morning. I'll break down those two surveys. We'll talk about the findings of those. I'll break them down by survey, but also by some different subsections of items and topics that we looked at within those surveys around risk reduction, safety cultures, which we just talked about, and also organizations' levels of how they innovate and collaborate with one another. And then I'll just wrap it up with some key takeaways, and maybe we'll have time for a couple questions at the end. But first off, what do we do in the MSD Solutions Lab? We were founded back in 2021, resultant of a philanthropic donation from Amazon to really sound the alarm on the pervasiveness of the impact of MSDs. So we do a variety of things in the lab. We conduct research and develop practical resources like has been shown before. We offer MSD prevention maturity assessments through what we call the MSD Solutions Index, which I'll talk a little bit about. We also host educational opportunities like this one for safety and health professionals through conferences, regular webinars. We amplify the impact of MSDs and subsequent importance of focusing on MSD prevention efforts. And we also have a large focus on innovation that we showcase through an annual grant program that we're going to talk about, I think, when we wrap up the conference today. So we got a lot of irons in the fire at the MSD Solutions Lab, but it really kind of boils down to this mission, which is to eliminate MSDs from workplaces so that workers can spend more time doing the things that they love with the people that they love. And I think this really hits close to home for a lot of us, and I think it's why all of us are in the room. One of the main components, though, of the MSD Solutions Lab is something that we call the MSD Pledge. And so this is a kind of a call to action for organizations that want to say that they are also committed to MSD prevention within their organizations. So we currently have over 250 organizations that have committed to reducing MSDs in their own workplaces through this MSD Pledge. So this is something free that folks can just commit to. They get some free perks from being involved in the Pledge community as well, access to some of those grants like I talked about, some exclusive events that we host through benchmarking and office hours with folks in our lab, which is kind of like a free hour of consulting that they can get from us once a month. And plenty of other resources and things as well for those in the Pledge community. And they're really kind of structured around these three tenets. And so this is clustered on risk reduction, that innovation and collaboration piece that I mentioned, and also safety culture. So when folks are joining this MSD Pledge community, we're really asking them to look at and hone in on these three aspects of MSD prevention in their own organizations. And so I'll share just a little bit if you're interested in the MSD Pledge or if your organization wants to join, I'll share just a little bit of a way to do that at the end as well. But okay, that's a little bit about the MSD Solutions Lab. Our website should be linked in resources or things that you guys have, so feel free to browse around and find out some more about the lab or come find me or Rom during the conference today and we can answer any questions that you have. But now I'm gonna jump into some data. So this is kind of a data dump, if you will, for this morning. So I'm gonna be talking a lot about some data that we gathered from Frontline workers just in the past year, and also about that MSD prevention maturity assessment that I mentioned that we call the MSD Solutions Index. Those are two interesting surveys, different samples that we looked at, frontline workers and safety and health leaders. And we saw a lot of disparity in between how they're feeling about MSD prevention efforts in their workplaces. So I'll get into all of that in the coming slides. So just to introduce these, what's really the point of them? So the MSD Solutions Index is something that we offer annually to those folks that are within the MSD Pledge community. It's a free kind of MSD prevention maturity assessment that they can take annually. And it's really just to understand better their MSD prevention initiatives, and we also provide them with reports after they've completed that to let them know, hey, these are areas where you're excelling, these are some opportunities of maybe some components you guys could add into your program to bolster that. Really anyone within the Pledge community is allowed to take that, so all you have to do is take the Pledge to be able to access that survey. So any of those 250 organizations that we have involved. But the kicker is that it's taken by a single person, typically a safety and health leader who's the person who signed the pledge for the organization. So they might have a little bit of a different perspective. Probably they know the most about the efforts that are happening within their organizations, but we see that that might be a little bit different from frontline workers on the job every day. What are their perspectives of the efforts that they have in place? But just a little more into the details here. So this is about 50 items aligned to those three pillars within the MSD pledge that I talked about. So risk reduction, culture of safety, and innovation and collaboration. So they answer a variety of questions about each of those things. But then as we kind of presented some of the data on the MSD Solutions Index, the question kept coming up over and over again, like, hey, this is just a single person's perspective. What about everybody else? What about the workers? How do they feel about what's happening in their organizations in regard to MSD prevention efforts? And so that spurred us to launch this Frontline Worker Survey, as we called it, that we collected data through last summer. And so this is really the same purpose, just from a different lens. We wanted to understand frontline worker perceptions of MSD prevention initiatives in their organizations. So we got a sample of 1,000 frontline workers that were in a non-managerial job title, which is kind of how we deemed that they were a frontline worker, that lived in the US, that were in the working age population. A little bit shorter for them, given that we know they might not have as much time to complete something like this. So 28 items, again, around those same clusters of risk reduction, safety culture, and innovation and collaboration. The items largely mimicked the index, but there were certainly some items that we asked on the index that we wouldn't expect a frontline worker to know, like, do you use the RULA or the REBA assessment? So we kind of tailored the items to be a little bit more comfy for the frontline worker. So I'm just going to jump into some of the data here, and I'll present the frontline worker findings first. I think they're pretty cool, and I'm going to spend a little bit more time talking about those than I will talk about the index data. But this is exciting, and we have some continuing on surveys in this frontline worker realm as well. So this is just kind of a lay of the land of what do you think about your MSD prevention initiatives, and we have a survey that's in the field right now, actually, that's what do you think about MSD prevention technologies, which is definitely a little bit more niche. But we've already collected like over 350 responses to that survey, so it's looking pretty good. But all right, jumping right in here. So we found that workers stated over 2/3 of the time that their workplaces do have something that's a MSD prevention or ergonomics program. This is promising, but we would want that to be 100%. So we got over half, we got over 2/3 really, but still some room for improvement there. When asked if they understood even what MSDs were, just under 20% said they had little to no concept of what MSDs were. And that's kind of related to this next finding, which was a free response that we allowed them to provide, which was, well, okay, tell us what you think MSDs are. They gave decent definitions of what MSDs were a lot of the time, but the correlation between ergonomics and MSDs was not present in the responses that they provided. So something is missing there. They don't understand conceptually that these things are related. They know that their organization has efforts for MSDs, but they don't understand the ergonomic play into that. So some really big mismatch here, with less than that 1% mentioning ergonomics at all in that free response item. Going a little bit deeper here, workers stated that their workplaces were able to prevent MSDs on a similar frequency to how ergonomics was discussed in their workplaces, which is kind of interesting. And so you can see in this graph, this is just showing those two data points here. So you think that your workplace's ability to prevent MSDs is good, the more often ergonomics is discussed in your workplace. Which also gets into some of that culture piece on if we're just communicating about the importance of ergonomics or MSDs within the workplace, workers might perceive that their workplace is doing a better job of preventing those MSDs. So looking a little bit more into risk reduction findings from our frontline workers, we asked about pain that they've experienced. 29% of them reported that their pain goes unreported, so they don't report the pain that they experience. So something going on here, do they not know how to report? Do they work somewhere where maybe the culture doesn't elicit that they would want to say that? Is there some misunderstanding of the methods that they have to report? Do they maybe not even think it's important? Like, oh, just my shoulders being sore is an aspect of my work. It's not worth reporting. Something going on here that I think we need to dig into a little bit more. And kind of a follow-up to that, some workers did mention that they don't know if they have or they perceive that they don't have a method in place for reporting early pain as well. And then I know we looked at some demographics through Jack's presentation, but we also did a little bit of digging into these data, looking at demographics as well, and really looking at age here. So this graph is showing some discrepancies in age and experiencing pain at work, showing that older workers are less likely to say that they experience pain. So either this is true, and maybe older workers are on the whole less exposed to risky work, or workers that are older are less connected to ways to provide or report that pain. So again, something I think that we can do to dig into this data a little bit more to understand some of the differences that we're seeing in older workers. And we'll see this trend of older workers maybe being less connected to ways to report, ways to speak up throughout some of the survey findings. Also, I thought I would show some industry differences here as well. So we collected information about the industries that these workers were in. And so this graph is specifically honing in on differences between how much workers reported experiencing pain and how often they were asked about that pain. So we would hope that we would see folks maybe being asked about pain at least on par with how much they experience pain. But unfortunately, that's not the case for a lot of industries. So maybe take, for example, like the construction industry. And so the lighter green is that they're asked about early signs or symptoms at least once a year. And that darker green is how often they're saying they experience pain at work. So there's a big mismatch between how much they say that they're experiencing pain, but how much folks are even asking them if they're in pain. You can also see that some industries are maybe performing above average on this. So our utility friends are sticking out there that they're asking about pain more often than their workers are saying that they're feeling pain. And then some industries are kind of right. They're maybe where we could say they're quote unquote supposed to be, like manufacturing and professional scientific and technical services. So again, some differences here that we're seeing by industry and how much we're interacting with our frontline workers. But maybe we have something to learn from utilities or manufacturing and other industries that do seem to be doing this a little bit more cohesively. And so shifting gears, looking at some of the safety culture findings from this survey. So kind of at a bare minimum, our workers being asked to share their feedback in perception surveys. So we know lots of organizations offer culture, perception, engagement, whatever you want to call them, surveys. Are they even offered these types of things? Again, we're seeing some age differences here. So younger workers reported that they were more likely to be offered these things. Just diving in a little bit deeper, 63% of 18 to 54-year-olds work in a place where they have such surveys, and this number tapers off as workers get older. Again, is this just they truly don't work in workplaces that have them, or they're not connected to those? I think both of those are important to dive into. Maybe it's a communication and awareness piece that we need to bring to light. And also this graph is showing another breakdown by industry. So we see some of those same trends again. Construction is lagging a bit behind. This is just offering perception surveys in their organizations. So seeing some differences here again by industry. Utilities is performing well in this category as well. Some other industries as well. But just seeing some differences in organizations' willingness to ask about these types of things in general. And so keeping on going with safety culture findings, most workers say that they have methods in place to share safety or ergonomic improvements or suggestions. So if they were asked, is there some type of pen and paper system that you can utilize? You have some kind of electronic system that you could utilize to provide ergonomic suggestions. Most workplaces are saying that they do have that. But again, we're seeing some of that disparity between methods for sharing and who might be sharing. So again, looking by age, we're seeing that same trend with our older workers again. So saying that they are less likely to have methods to share, that they're less aware of methods to share some of these ergonomic improvements or suggestions. So again, something going on with that group on the front line. And so this is kind of a big one here, and this is an item that we really juxtapose with the item that we collected through the MSD Solutions Index, so through the safety and health leaders perspective. And this, we saw vast differences between how frontline workers and safety and health leaders respond to this cluster of items. And so frontline workers, their most common bucket here, and the green kind of got lost here, it's olivish green, starting with a 35.7% is never. So they're saying that they're never asked about their return to work processes. So that was the most common answer that they gave. Not to say that they weren't, always or sometimes involved, but the most common selection that they picked was, I'm never asked about that kind of thing. I'm not included in decision making around that. And we see that very differently from a safety and health leader's perspective. They're saying, oh, they're included, very frequently. We're doing a great job of asking them about that. So there's some kind of discrepancy, either in actuality or in perception of frontline workers on their inclusion in some of this process. So I think something really big to dig into here, and we have a report that came out at the beginning of September that hones in on some of these data a little bit more. And maybe not surprising, I think this is something that we see in lots of organizations, so not something maybe to just be worried about exclusively in this silo. But as hierarchy increases, workers also reported that trust decreases. So we're asking frontline workers about their levels of trust, trying to get at that safety culture piece in their organization. They're experiencing trust between folks at their same level, and that trust is tapering off as they get higher up in the hierarchy within their organization. So maybe this is an argument to make sure that safety teams have equal representation, that it's not just a bunch of higher-ups on your safety teams, include frontline workers, and that to make it feel a little bit more approachable. But again, interesting finding that we saw from the frontline workers. And I think goes to show that this trust-building piece from senior leadership is really something that we ought to be working on more. And finally, we asked workers some questions about their technology readiness or how excited they were for technology within their organizations, and specifically technology to prevent MSDs. So I will say most of the frontline workers did say they were excited. I think the number is like 41% or something, so that they're actually excited about the impact that technology could have in their workplace, which is pretty cool. I think that aptitude is growing and growing for frontline workers to want to be involved in that. But for those who said that they maybe were a little concerned about implementing technology in their organizations, some concerns maybe that are typical, so around how is the data going to be used, am I going to be replaced in my job, are some of their primary reservations. But then the things they were excited about, that it's going to increase their productivity and efficiency, so probably not surprising, or make whatever they're doing of higher quality or better service. So just some differences there that we found as well. And it's kind of what spurred us into doing that follow-up survey on diving deeper into MSD prevention technology from the frontline worker perspective. So what does this tell us? This is a lot of data about frontline workers and their perceptions, but what can we boil down? What do we need to do about this, or what does leadership need to take on? So from my perspective, I think this shows a need for leaders to more clearly communicate MSD prevention strategies and the impact that they have. We're clearly seeing some type of gap demographically, but also I think workers are just not as connected maybe to the MSD prevention efforts. They're clearly not correlating MSD and ergonomics together. So something needs to be done around this communication piece. We also, given that we're seeing that, I think it was almost 30% of workers said they don't report their pain at all. We need to more proactively engage workers and getting them to want to report pain and understand why that's important for them and their health. Also seeing some of those differences in trust and how that's tapering off the higher up someone is getting within the organization. Really that fostering trust through transparency and consistent support is important. And also given that frontline workers are feeling like they're not asked about decision-making related to a lot of their work activities, I think we need to do a better job of finding ways to involve them in that activity, whether it's through walking on the shop floor through a Gemba walk, having those perception surveys, or having other systems in place to try to get some of that feedback would be really important. And given some of the data that we saw around the aging workforce, I do think this needs a little bit more addressing. So what's going on here? How can we ensure that what we're doing is always addressing kind of the diverse needs of our workers as well? All right. So kind of fast and furious through our frontline worker survey results there. And so now we'll introduce some of what I'm calling the safety leadership findings. So these are some of the findings from the MSD Solutions Index. So a lot of these same types of items just asked from the safety leader perspective of folks who were in the pledge community. This is, I will call it fresh data. I'm analyzing it right now. We plan to usually publish these reports at the end of the calendar year. So this is kind of preliminary, but it's what we're seeing so far. So instead of going item by item here, like I mentioned, I'm going to do a little bit shorter of an overview of the MSD Solutions Index data that we're getting in right now, but some things that we're seeing kind of clustered by grouping here again. So the safety and health leaders that are utilizing technology, we're seeing that gives them kind of a stronger risk reduction score that we're giving them in the MSD Solutions Index. And that those items are not clustered within one another. So there is some type of true relationship between that utilization of technology and better risk reduction in their organizations, which is promising to see. We're also seeing, we have 3 years of data within this MSD Solutions Index now. We're seeing some upward trends in the utilization of technology overall, and whether folks are actually implementing it, piloting it, doing some research on it. So again, maybe not a surprising trend, but we are seeing that within our group as well. Something that's been really exciting to see is that, especially since year one, we've seen a shift in the types of indicators that organizations are tracking. So in year one, we were seeing that lagging indicators were more commonly being tracked by organizations. And as the years have gone on, so even in year two, we were seeing a creeping up of leading indicators being the more commonly tracked metrics for organization. And that trend sustained in our year three data set. Which is really exciting to see, because I know there's a really big push around that right now, kind of switching our focus from things like TRIR or other types of lagging indicators into some of these more leading indicators that can help us be more proactive. Another interesting finding, though, from the safety leader perspective is that when we ask them kind of one question, which is a little singular, but what types of interventions do you most commonly employ within your organizations? And there's a couple different options they can pick. Are they employing things like at a systems level, which is having it really integrated into their MSD prevention programs, maybe using things like technology, robotics, to get it eliminating MSD risks? We ask if they use interventions at the organizational level. So is it things like work schedules, workstation design, maybe a little bit lower on the hierarchy of controls? Or is the most common intervention type that they're utilizing kind of at the personal level or at the PPE level? And this year, kind of a switch from some of the previous years, we were seeing a much larger chunk kind of at the bottom of the hierarchy of controls there, so at that personal level of intervention. So a little bit off of where we would want to be. I think we want to be focusing a little bit higher up in the hierarchy of controls, having some engineering controls in place, which I'm sure we're going to hear about from our speakers this afternoon. But at least in our sample, we're seeing that some of the focus is still remaining on PPE and personal level interventions. I definitely want to make a switch from that. Something else that always, and this data piece kind of always shakes out in the index, but it's sustained this year, is that less than half are using formal risk assessments. So they're saying that they use something that they've created themselves. They're not using some type of standardized risk assessment within their workplace. So I think, again, another education piece around the importance of utilizing something standardized would be good there. But we're seeing a large number saying that they have MSD prevention programs. They're in our MSD pledge community. They ought to have MSD prevention programs, but some of them are still newer to their journeys, so they might not all have MSD prevention programs just yet. But some promising numbers there, and that's also gone up year over year. And something that we always look at too is organization size. And so we do see that larger organizations are showing stronger MSD risk reduction performance on the index. So the index is something that we score. And those larger organizations are having higher scores in risk reduction. But we'll see that that doesn't always sustain when we look at some of the other content areas within the survey. So moving into safety culture, kind of got a mixed bag of folks if they're using a perception survey. So a little bit over half are saying that they utilize these surveys within their organizations. Looks similar to what frontline workers are saying. So I think we have a little bit of validation between those items. Also, we asked them a question about does your workplace provide your frontline workers with the proper ergonomic tools and types of things to do their work? Also, when you're having shipments come into your workplace, are you thinking about the ergonomics of your pallet size and how many pallets are loaded, how heavy things are? We asked the safety and health leaders that, and we are seeing that there's a correlation between that as well and safety culture, which I think makes a lot of sense. If you're having this in place, I think that signals to workers that your workplace cares about you. So I wasn't surprised to see that. Something that we've really been interested in tracking, and I know that Jack showed the psychosocial risk factors resource that CRE-MSD has, but it's something that we're paying attention to in the lab as well. Do folks even understand that these non-physical risk factors are impacting MSD likelihood within their organizations? And this number was, I want to say it was like in the 70% in our year one data, and this has really crept up over time as well. So organizations are really, really understanding the linkage here. But when we ask about if so yes, you understand that they're impacting, but do you actually measure these things, or do you have some kind of way to quantify non-physical risk factors within your workplace? Less than 50% have ways that they actually do that. So we know that they're happening and impacting MSDs, but we don't have any good ways in place that we're measuring or kind of tracking these things. So definitely a growth area, I think, for organizations. And like I mentioned when we were looking at the frontline worker data, but leadership consistently over-reports their employee involvement than the workers perceive, so that's clearly some kind of mismatch that we need to get a grip on. But then something interesting here is that safety culture and organization size, we did not see a correlation between those things, which I think is nice to see. Your organization could be of any size to create a strong safety culture. You don't need to have all these fancy well-being or other initiatives in place to have that strong safety culture. It could even be made with an N of 10. And And last but not least, looking at our innovation and collaboration section of the index, so this is our smallest section. We ask organizations if they share about, if they have a win, if they share about that. So are you sharing your effective MSD solutions within your organization and also outside of your organization? We see that folks talk about that really commonly within their organization, but that external knowledge sharing is lacking for some of them. So I think that's a number that we want to see come up as well. I think that's why we're here today. We're trying to knowledge share with each other and getting organizations to not feel that some of the solutions or things they developed are proprietary or things that they own, I think is a good way to go. And then we're seeing kind of similar numbers, like I mentioned, around technology usage. So a little over 3/4 say that there's some way utilizing technology. So something to keep tabs on there. So some key takeaways from all this data. So what really does this boil down to? What should we focus on? So I clustered this into a couple different buckets here, but we really have to strengthen frontline leadership by actively fostering trust, encouraging open discussions about pain, and promoting inclusive decision-making to ensure really genuine worker involvement. Leadership really needs to also start aligning perceptions with reality by engaging workers kind of in a more meaningful way. We also need to expand and deepen MSD prevention efforts by increasing adoption of technology that effectively reduce risks and shifting away from some of those more personal level interventions like we saw to some of these more systems-based approaches. Additionally, like I just mentioned, we need to improve measurement practices. We're not utilizing formal risk assessments maybe as often as we should, and also need to find some way to measure and quantify the impact of non-physical risks. And so I'll just wrap up with a couple QR codes and just a plug for some of the resources in the MSD Solutions Lab. We have a lot of case studies and other types of guidebooks, infographics, briefs that you can utilize by scanning that QR code. Again, I bet the link is floating around out there somewhere as well. And then if you're interested in the MSD Pledge, like I mentioned, it's a growing group of organizations that are committed to MSD prevention in their own workplaces. And so we have over 250 organizations. You can be possible to receive a pilot grant if you're interested in that, and lots of other exclusive opportunities. So if you're interested in that or just want to learn more, you can scan that QR code as well. All right, that's it for me. Thanks for hanging there. All right, any questions? I know that was a lot of data, so thanks for hanging in there.
We do have time for one or two questions if folks have something pressing to ask. Front right here.
Yeah.
What are the leading indicators that you mentioned?
Yeah, like leadership commitment, utilizing some of those perception surveys. If organizations track things like the number of near misses that they have or even number of high-risk jobs that they've eliminated, those are a couple that we're tracking through there. But there's a host of others for sure. Yeah. Yeah, Blake or someone else?
I guess maybe a question that,
Oh, and online too, okay.
that connects all three presentations. In your opinion, would you, or it's the group, would you consider MSD risk a PSIF and an MSD injury a SIF? And if so, should our profession be lobbying for that level of classification?
Yeah, I think that's a great question. I think it's something that ROM is actively working on a paper related to that, is maybe there are some MSDs that can be classified as SIFs. I think we definitely know as MSD prevention, researchers, practitioners, that sometimes an MSD is certainly life-altering. If that's the definition of what it means to be a SIF, then I think we could definitely make the case to categorize at least some MSDs into SIF. Oh, SIF, sorry, yeah, serious incidents and fatalities. So usually kind of deemed as life-altering, but typically, a fall from height that results in some kind of, severe injury or an amputation or something of that sort. Yeah. Is there one online, Kim? Yeah.
Yes. Thank you for sharing these survey results, very insightful. Interested in whether diversity was assessed beyond age groups. For
Yeah.
example, did the survey consider ethnicity or language access, and were translation supports provided to help capture a wider range of voices?
Yep, good question. So that is definitely a con of the Frontline Worker Survey. We only collected age, kind of given the survey vendor that we partnered with, that was the demographic variable that they could reach for us. But through the prevention technology survey that we're running, we've added race, ethnicity, language, and those types of demographic variables. But yeah, good question.
Right. I know there's a few more questions, but we have all day together. So, Chris, if you don't mind, I encourage you to come on up after here for a moment. Please join me in thanking Paige for a wonderful talk.
Thank you.